active release technique the same as myofascial release technique? Myofascial release is a way of manipulating and restoring movement to tissues that surround your muscles called fascia. Active release technique is arguably the most advanced and effective form of myofascial release pretty much ever created. Active release is a well thought out or packaged form of myofascial release, and it requires a lot more mastery and education and studies to be able to get certified. So beyond chiropractic school, students and doctors are required to take more hours and have more practice to be able to be active release technique doctors or ART doctors. Myofascial release technique is there to break up scar tissue or adhesions within the fascia. It really tends to help with disorders such as Temporal Mandibular Joint disorder or TMJ disorder, Carpal Tunnel Syndrome, which a lot of our at-home desk workers or computer workers and engineers are really familiar with, and possibly to even help with fibromyalgia and headaches. These could be migraines or tension headaches, but releasing the muscles at the right spots can help relieve pain at different parts of the body. Other conditions that are also well known for active release technique is lower back pain, chronic neck pain, and also shin splints. Active release technique or ART is more pinpoint myofascial release work, and it helps a slew of different types of conditions, including neck pain, low back pain, tension headaches, shin splints, and plantar fasciitis. It can also help with more uncommon conditions such as frozen shoulder pain and sciatic nerve pain. It really depends on the type of condition that a patient may present with, and how specific it is to where their pain points are and if they have any referral pain points. So the doctor will do a thorough examination to determine if myofascial release technique or active release technique is better for you. The benefits are similar in the fact that it will help increase range of motion. It'll help to take down your inflammation levels, as well as help you get back into the activities that you are seeking to do. The other great benefit of both active release technique and myofascial release technique is that it prevents re-injury. So opening up the joint, breaking up the scar tissue or the myofascial adhesions can help increase that range of motion, so that way you can use that joint fully, so that way we're not going to cause another injury or a re-injury. Active release technique is a soft tissue method that focuses on relieving tension via the removal of adhesions, which can develop in tissues as a result of overload or repetitive stress injuries or RSIs. What are the contraindications of this type of technique, or which types of conditions are we not supposed to be using this technique with? That would be any sort of malignancies, aneurysms, tumors, if you have pretty severe rheumatoid arthritis, as well as advanced diabetes or any sort of osteoporosis. We practice both myofascial release technique as well as active release technique at our San Francisco clinic. The providers are certified in providing both of these techniques. And so you can be rest assured that you'll be getting the best possible treatment that's going to be tailored to what you need and your condition at our San Francisco clinic. We usually recommend that patients wear loose clothing or exposing the area that needs to be treated at our clinic. So that way, our providers can get a more hands-on approach to treating you, quickly and effectively to get your pain levels down. Well, each depends, in terms of length of time, depends on how long you've had the condition for and how chronic it is. And so the provider will be able to determine that at your first visit or consultation. The cost of the treatment does depend on what areas need to be worked on. But at our clinic, the costs are very standardized and very competitive compared to other clinics in the San Francisco area. Do you have a condition that you feel might benefit from active release technique? Give us a call at our San Francisco clinic, 415-421-1115, to get a spot on our calendar now.